This is a really historic day because for the first time since the GMC was established back in 1858, the announcement today and the change in the law means that every doctor who has a license to practice will need to show on a regular basis that he or she is up to date and fit to practice. What's happened in the past and what's happened since 1858 is that once a doctor had qualified and was registered by us, obviously their name stayed on the register unless they did something which led us to remove it. But there was no legal way, no explicit way in which those looking at the register would know that a doctor had indeed stayed up to date in their area of practice. Now the reality is, of course, most doctors do, and we know that. But this is a way of confirming and assuring the public that everyone who is on our register with a license has shown and has proved that they are up to date and fit to practice. If you're working in an environment, a hospital, general practice, or another organisation that has well-established appraisal, where you may already be doing 360-degree appraisal, or multi-source feedback as we call it, you may actually not notice much difference at all. And certainly where I work, this has been the case for some time, and I've had an annual NHS appraisal for over 10 years now. I've done both patient and colleague questionnaires a couple of years ago and again earlier this year. And if you're already working in that kind of environment, you won't notice much change. If, however, you're not working somewhere where appraisal is well established, or more likely if you're working somewhere where multi-source feedback is not well established, then you need to start to get ready to do both those things. All the feedback we're getting is that most of the NHS around the UK is now up to speed with appraisal. We're determined that this should not be a bureaucratic process. We want it to be as simple as possible because we know it's got to work out there at the front line for lots of doctors. We know it's not perfect, and we know that revalidation will improve and become more sophisticated as the years go on by. We know that some locum doctors, particularly those who are not geographically stable, will face some challenges, and we've been working for a couple of years now with the locum agencies to try to ensure that those doctors have access to the information and the appraisal systems that they need to become revalidated. But in most cases, for most doctors in most organisations, we know that we are ready to start, which is why the legislation is being activated. By Christmas.